Today we are going to see the heart internal features. So let's keep the heart once again in anatomical position. Let's see the chambers. Left ventricle, right ventricle. This is right atrium, left atrium. Now we are going to open the right atrium. This is superior vena cava, inferior vena cava, superior vena cava, here superior vena cava. Now we are going to give an incision just right of the superior vena cava. That extension will go, that incision will go down up to the right end of inferior vena cava. And this is how we open the right atrium. So when you open the right atrium, you can see this is the chamber here. Also we have opened the right ventricle. So this is the right ventricle here. We have given an incision which is on the right anterior coronary sulcus. Then from there at the inferior border up to the apex. So we open the right ventricle as well. Now we will go back to the right atrium. So this is the right atrium. Right atrium is forming 1/3 of base of the heart. It also forms the right border and the right surface. It is also a part of sternocostal surface. Right atrium is a quadrilateral chamber. Right atrium has got a projection. This projection is called right auricle. Right atrium is separated from the right ventricle. Right atrium is separated from the right ventricle by the sulcus here. That is called coronary sulcus. Now this is called the right anterior coronary sulcus. So right atrium, and here this is the orifice called right atrioventricular orifice. So my forceps is right now in the right atrium. Now here this is right ventricle. So this is the orifice here which is called right atrioventricular orifice, which is guarded by a tricuspid valve. Now let's see the features of the right atrium. Before going to that, let me tell you that the atria are separated by interatrial septum. So this is right atrium and this is left atrium. Left atrium is not open. Right atrium is open. Similarly, the right ventricle is separated from left ventricle by a septa which is inside, that is called interventricular septum. Right atrium has got 3 parts: a posterior part, anterior part, and interatrial septum. So this is the posterior part, anterior part. Anterior part is in front of sulcus terminalis. So here I told you there is an incision which we have given. That incision is almost passing through the sulcus terminalis. So whatever structures are which are in front of sulcus terminalis. This area of the right atrium, which is in front of sulcus terminalis, is called the anterior part. The structures which are behind it, that's called posterior part. And here, this area, that is your interatrial septum. Now, as you can see here, the anterior part is rough, posterior part is smooth. Also, you can see the interatrial septum, which is also smooth. Now, the posterior part, where we can see the openings of this structure, that is superior vena cava, inferior vena cava. Also, you can see one more structure that is opening here, this one, that is called coronary sinus. Coronary sinus is here. This is coronary sinus. Outside you can see it. Coronary sinus is opening into the right atrium. So this opening is between the inferior vena cava opening. I hope you remember inferior vena cava. This is inferior vena cava, and the opening of right atrioventricular orifice. So the location of coronary sinus is between inferior vena cava opening and the right atrioventricular orifice. So the upper part of the sulcus terminalis, this is sulcus terminalis. In the upper part, SA node is present. In the posterior part of the right atrium, we can see the opening of superior vena cava, inferior vena cava, coronary sinus. In the posterior wall of superior vena cava, when it opens into the right atrium, somewhere here, at this area, there is a projection, elevation. That elevation is called intervenous tubercle of lower. Intervenous tubercle of lower directs the blood from the superior vena cava to the right atrioventricular orifice. So the blood from here, it moves to the right atrioventricular orifice in the fetal circulation. Similarly here, this is inferior vena cava. Inferior vena cava has got a valve. That valve here is called the valve of inferior vena cava. It is also called eustachian valve. Eustachian valve will direct the blood which is coming from the inferior vena cava to the foramen ovale. Foramen ovale is a connection between the right atrium and the left atrium in the fetal circulation. Right now the foramen ovale is not there here, it is closed, but it was there before. Now moving on to the anterior part of the right atrium, this is sulcus terminalis. So this part here is the anterior part, rough part. Now the sulcus terminalis is seen outside. Internally, this is representing the sulcus terminalis, that is called Crista terminalis. Crista terminalis. So from the Crista terminalis, we can see the muscular ridges which are moving downwards and forwards, and these are directed towards the atrioventricular orifice. So this is atrioventricular orifice. So see the direction of these ridges. These ridges which are arising from the Crista terminalis are called as musculae pectinati. So musculae pectinati can be seen here. And This is the right auricle which is cut here. Right auricle also has muscular ridges. You can see network of muscular ridges in the right auricle. Now this region here is called the interatrial septum. Now here the first one that you can see here, this is a depression here, which is a thumb print shaped impression or saucer shaped impression or oval impression. This is called as fossa ovalis. There is a sharp upper margin for the fossa ovalis that is called limbus fossa ovalis. Fossa ovalis is a remnant of septum primum, whereas limbus fossa ovalis is a remnant of lower end of septum secundum. So between this septum primum and the septum secundum, which was there in the fetal life, blood was moving from right atrium to left atrium. Now but here it is closed, and that gap between the septum secundum, the septum primum, is called foramen ovale. But now these are closed. Now this is the remnant of septum primum, that is fossa ovalis, and this is limbus fossa ovalis, that is nothing but the remnant of lower end of septum secundum. Now antero superior to that, antero superior to fossa ovalis, in the interatrial septum itself, somewhere here, there is an elevation. This elevation is called as torus aorticus. Torus aorticus is an elevation which is produced by non-coronary sinus of the ascending aorta. So this is ascending aorta here. So here it produces a non-coronary sinus of the ascending aorta, produces an elevation that is called torus aorticus. Now here in the interatrial septum, somewhere here, we could see a sharp elevation here. This elevation is extending from the valve of inferior vena cava. So this is the inferior vena cava here. Now the valve of inferior vena cava is here. So there is an extension of inferior vena caval valve towards the central fibrous skeleton of the heart. So this is called tendon of Todaro. So this sharp elevation here is called tendon of Todaro, which is a subendocardial elevation which is produced by the extension from valve of inferior vena cava upwards to the fibrous skeleton of the heart. Now in this area there is something called triangle of Koch. So triangle of Koch has boundaries. Anteriorly it is bounded by this structure here. So this is the right atrioventricular orifice, which has got tricuspid valve. Tricuspid valve has got three cusps. So this is septal cusp, which is arising from the interventricular septum, and this is anterior cusp arising from the sternocostal surface, anterior cusp, and there is one more cusp here which is arising from the inferior wall, or you can say posterior wall of the right ventricle. So this cusp here is the septal cusp of the right atrioventricular orifice. This cusp is almost triangular in nature. It has got a base and an apex. Base has a fibrous ring surrounding this, which is attached to the atrioventricular orifice. This is triangle of Koch. Triangle of Koch is bounded anteriorly by the base of septal cusp of the tricuspid valve, below by the opening of coronary sinus, the anterior margin of opening of coronary sinus, and above by tendon of Todaro. So the triangle of Koch is here. Anteriorly by base of septal cusp of tricuspid valve, posteriorly by the anterior margin of opening of coronary sinus, this is coronary sinus, and above by tendon of Todaro. At the apex of the triangle, we can see the AV node. So this is the location of AV node. So this is the right ventricle. Now right ventricle is open here. We can see the interior of the right ventricle, which looks like a sponge because of lot of irregularities that we can see inside it. Now before going to the right ventricle, let's see this orifice here. So this is right atrioventricular orifice. So 3 leaflets. Anterior, septal, because it is coming from the interventricular septum, and this is inferior. Now this cusp are attached through something called chorda tendinae to this structure here. This is called papillary muscle. Now inside this ventricle, we can see this rough area here. So this rough area of the right ventricle, which is just beneath the right atrioventricular orifice, is called the inflowing part of the right ventricle. Now inflowing part of the right ventricle is rough, and this is called the Trabeculae carneae. So whatever elevations we are seeing here, all are together called as Trabeculae carneae. Now the right ventricle will continue upwards. So this is the right ventricle. Above, it is going to continue. If I am putting a forceps, that will continue as this structure here, that is called pulmonary trunk. So this is the pulmonary trunk. We can see that here. So I told you before that the right ventricle has got 2 parts. The inflowing part, which is rough in nature, that is called Trabeculae carneae. The outflowing part, which is going to continue as pulmonary trunk, and that is called, this part is called infundibulum. So I'll just try to explain this from here. So we can see the pulmonary orifice. Now inside it here, we can see here we can see a elevation. That elevation is called supraventricular crest. Supraventricular crest is dividing the right ventricle into a lower part, that is called the inflowing part, whereas the upper part, that is called the infundibulum. Infundibulum is going to continue as the pulmonary trunk. Now the Trabeculae carneae here are of 3 types. So first we will see a type of Trabeculae carneae. These are called as pillars. Usually pillars has got one attachment, that is towards the ventricular wall. As you can see here, this papillary muscle is attached to the ventricular wall. So this is the anterior wall of the right ventricle. So it's attached to the anterior wall, the base. It has got apex. Apex is attached usually through this fibrous structures here. These are called as chorda tendineae. Chorda tendineae is attaching to the free end of the leaflet of the tricuspid valve. So here this is one leaflet which has got base and apex. So apex is attached to the chorda tendineae. Chorda tendineae is attached to the apex of papillary muscles. So there are three papillary muscles as we can see here. So this is the anterior aspect. So there is a papillary muscle here which is coming from the anterior wall, and that is called the anterior papillary muscle. There is another papillary muscle which is arising from the inferior wall. This is the inferior surface of the heart. So from here we can see this muscle, this part. This is the another papillary muscle which is called posterior papillary muscle. So look at the difference between the size of anterior papillary muscle and the inferior papillary muscle or posterior papillary muscle. Anterior papillary muscles are large. Anterior papillary muscle is large, whereas the inferior papillary muscle or posterior papillary muscle, which is small in size. There is one more papillary muscle that here we can see, this one, which is arising from the interventricular septum. So this is interventricular septum here. So from there we can see some of the papillary muscle. These are called the septal papillary muscle. So there are three papillary muscle: anterior papillary muscle, which is arising from the anterior wall; posterior papillary muscle, which are arising from inferior wall; septal papillary muscles, which are arising from interventricular septum. Anterior papillary muscles is single. Posterior papillary muscle is also single, whereas septal papillary muscles can be of multiple in number. Now anterior papillary muscle is attached to the anterior cusp. Posterior papillary muscle or inferior papillary muscle, which is attached to the posterior cusp. Septal papillary muscles are attached to the septal cusp. So in fact, you can see here, this is anterior papillary muscle, inferior papillary muscle, and this is septal papillary muscle. You should also remember that the anterior papillary muscle is mainly attached to the anterior cusp, but it is also attached to the posterior cusp. Similarly, the inferior papillary muscle or the posterior papillary muscle is attached mainly to the posterior cusp, but it is also attached to the septal cusp. The septal papillary muscle is attached to the septal cusp, but it is also attached to the anterior cusp. So in the Trabeculae carneae, the first group of them, that is called the pillars or the papillary muscle. Now the second group is called as bridge. So the bridge, usually bridge is connecting two ends, but the center of the bridge is usually free. So similarly here we can see this is interventricular septum, this is anterior papillary muscle, So here we can see a structure which is connecting the interventricular septum to the base of anterior papillary muscle, and this is called as a bridge, and this is also called as moderator band. It is also called septomarginal trabeculae. Septomarginal trabeculae has the right branch of AV bundle, that is called bundle of His. Now this will carry the information from the conducting system to the anterior papillary muscle. So when the ventricle contracts, the right ventricle contracts, at the same time the anterior papillary muscle also contracts, so that it is going to control the cusp of the tricuspid valve, so that it does not prolapse into the right atrium during ventricular systole. Also, the moderator band is supplying the anterior wall of the right ventricle, which is nearby the base of anterior papillary muscle, so that it prevents the overdilation of right ventricle, because the right ventricle wall is thin compared to the left ventricle. So that is why it is called as moderator band. Now we have seen two things in Trabeculae carneae. The first one was pillar, second one was the bridge, which is called the moderator band. Now the third one is called ridge. Now whatever we can see here, the irregularities other than the papillary muscles and the bridge, we can call it as the ridge. So these are ridges that we can see here. The best example of ridge that we have already discussed, that is called supraventricular crust. So supraventricular crust is here. Once again we can see that here, which is dividing the right ventricle into upper part and a lower part. So this is the ridge. So when we try to see the right ventricle from the right atrioventricular orifice, and we are trying to put our forceps into the right ventricle, it goes initially to the inflowing part, now it goes to the outflowing part, now it is going to appear here, and that is the pulmonary trunk. So we can see the pulmonary trunk here, which is cut, and the forceps can be seen here. So I am taking the forceps. Now here the pulmonary trunk is dividing into, here you can see that here. So this is ascending aorta. So this is pulmonary trunk. I have put my forceps into the pulmonary trunk where it is dividing. So this is the right pulmonary artery, and here this one will be the left pulmonary artery. So once again we can see the pulmonary artery, pulmonary trunk, the orifice, pulmonary orifice. So pulmonary orifice is going to continue as pulmonary artery. Now here we can see near the pulmonary orifice another valve, which is called a semi-lunar valve, or it is also called as pulmonary valve. So this is the pulmonary valve. It has got three cusps, 1, 2 and 3. If you look at one cusp, it will have a free margin and an attached margin. So there is a free margin and an attached margin. Again here a free margin and an attached margin. So attached margins are attached to the fibrous ring, which is in fact attached to the pulmonary orifice. So between the free margin and the attached margin, it forms a small pocket. as we can see here. Here also you can see a small pocket. Anterior interventricular groove, which is separating right ventricle and the left ventricle. Somewhere here is the apex of the heart. Now the incision has reached almost at the apex. Now from here we are going to cut this through the left border of the heart. So let's start cutting it from here. We are planning to expose the left ventricle. So left ventricle wall is 3 times thicker than the right ventricle, because the left ventricle is dealing with high pressure, that is around 120 millimeter mercury, whereas the right ventricle is dealing with 15 to 20 millimeter mercury blood pressure. So my incision is almost reaching the left auricle. So look at the thickness. So we can see some elevations here, as in this here. So this is a part of Trabeculae carneae that can be seen nicely. So we can see the muscles here. These are the papillary muscles. You can see the papillary muscle, the base of the papillary muscle, which is attached to the ventricular wall. You can see the apex of the papillary muscle, where we can see fibrous structures here. These are called cauda tendinae. Cauda tendinae is attached to the valve. Here the valve is bicuspid valve. So here you can see slowly. Bicuspid valve is also called as mitral valve. It is called mitral valve or bicuspid valve because there are only 2 cusps. There is an anterior cusp and a posterior cusp. The whole of the left ventricle is divided into inflowing part, that is called Trabeculae carneae, and outflowing part, that is called aortic vestibule. Aortic vestibule is going to continue as the aorta. The aorta. Now we are seeing the inflowing part or the rough part. So you may see some of the blood clots which are there here inside. Remember, there is no moderator band which is there in the left ventricle, whereas the right ventricle has got a moderator band. So this was the right atrium. Now here, this is left atrium. We are going to open the left atrium. So let me give you an introduction about left atrium. Here you can see the left atrium. These are the pulmonary veins of right side, right superior pulmonary vein, right inferior pulmonary vein, and here you can see the left pulmonary vein. So let's open the left atrium through the center. So we are going to cut from the center here. So incision is going at the center of it. I think we will extend a little more. So this is the interior of the left atrium. We can see that the left atrium interior is smooth everywhere, but it is rough somewhere at this point. Interior, this is the left auricle. In the left auricle we can see the muscular ridges, reticular arrangement of muscular ridges can be seen inside the left auricle, but otherwise almost whole area is smooth, as we see. Now I hope you remember this is interatrial septum, which you are seeing from the right atrium. Now this is interatrial septum. Interatrial septum that you are seeing from left atrium. This is interatrial septum from the right atrium, and this is the interatrial septum from the left atrium. So here the interatrial septum, or we can say the left surface of the interatrial septum, is called fossa lunata. Fossa lunata. The right surface here, it is called fossa ovalis. Fossa lunata. Now the right atrium is placed to the right of right ventricle, also posterior to the right ventricle. The left atrium is placed posterior to right atrium, also to the left of right atrium. So when we say that this is interatrial septum is placed medially as well as posteriorly. So it is slanted. That is why when we say the left atrium, when we look at the left atrium, when we look at the interatrial septum becomes anterior wall of left atrium because it is slanted. So if this is interatrial septum, it is not like this exactly, it is placed like this. So this is the right atrium and this is the left atrium. So the interatrial septum is placed obliquely so that it becomes a posteromedial wall of the right atrium, and this is your fossa ovalis. Whereas when you look at from the left atrium, the interatrial septum becomes anterior wall of the left atrium, and here we have fossa lunata. So let me try to explain the interatrial septum with my hands. So this is the right atrium, this is the left atrium. So in the embryonic life we can see two septa, and this septa is called the septum secundum and this is called septum primum. This is right atrium, this is left atrium. So it is like this. Now septum secundum is strong, whereas septum primum is thin. So this is thick and strong, whereas this is thin. So the blood from the right atrium was moving from right atrium to left atrium between the gap that is seen between the foramen, between the septum secundum and the septum primum. So the blood from the right atrium, which had high pressure, was moving from right atrium to left atrium through the gap between septum secundum and septum primum. So the gap here is called the foramen ovale. Now this was happening in the fetal life. Now when the baby is born, the lung starts to function. The left atrium receives the blood from the lungs. So in the left atrium, the pressure increases. So the septum primum will try to move against the septum secundum. But the septum secundum being thick and strong, it will not move. So that there is no gap between this. So automatically the septum secundum and the septum primum will close with each other, will join with each other, and the foramen ovale, which was there before, will be closed. Now this is the location of foramen ovale that we described before. Now in the or after the birth, what happens is that this is closed. But when you look at from right side, this part is called the fossa ovalis. So fossa ovalis is a remnant of septum primum. So this is the septum primum, this is septum secundum. Now after the birth, this area is called the fossa ovalis that we have seen here. So fossa ovalis is nothing but, it is a remnant of septum primum, whereas this is limbus fossa ovalis, which is nothing but the upper margin of fossa ovalis. So here, this is septum secundum, this is septum primum. So the lower margin of the septum secundum is called the limbus fossa ovalis. So